This is Scott Loveridge with the North Central Regional Center for Rural Development. Thank you for joining us today. I'm going to be your moderator for this discussion, and one of the things we wanted to do at the outset here, for those of you who haven't already done it, if you could please fill out the poll, and that'll give us just a sense of where folks are coming from in this discussion. It looks like we've got about 9 people that have answered so far, so that's good. Out of the 11, we could get a couple more responses. That would be even better. I'll give you another couple seconds to do that. This is being recorded, so you'll be able to play it back later if you'd like. People are already using the chat box. I will monitor the chat box throughout the discussion, that our presenters, resource people, have seen the questions and that they'll be able to answer them as we move through the webinar. I think with that, we'll turn it over to Soshanah Inwood to introduce the rest of the webinar and our other resource people. Of USDA NIFA project, Hired in Ag, that you'll see the website address for that here. It's being led out of the University of Vermont with Soshanah Inwood. And some of our other speakers today are Dr. Inwood and then Dr. Adam Kantrovich of Michigan State University Extension, Dr. Barbara O'Neill, Rutgers Cooperative Extension, and Dr. Roberta Riportella at Kansas State University Extension. It's great to have those folks on, and we'll get to their pieces here momentarily, but just a little bit of an overview of the project.
Can you hear me yet?
First. Hey, you're on. Good.
Oh, great,
Good.
great. Okay. Thank you, Scott. Okay. So thank you for your patience with that technical glitch. So today I wanted to briefly share with you some of the research that has been leading up to the Hired in Ag project and give you a brief overview of what we know about how health insurance impacts economic development and quality of life for farmers and ranchers. So I'm a rural sociologist, and much of my research has really focused on understanding farm growth and persistence in regions experiencing high population and non-farm development pressure, what's also known as the rural-urban interface, or the RUI. And over the last decade, I've been working in 10 different case study metro regions around the country, interviewing and surveying farmers and ranchers. And as you would imagine, farmers and ranchers at the rural-urban interface have a lot of pressures on them that really stems from population growth and development. And what's interesting is that from one of our surveys, when we surveyed farmers and ranchers in 5 of the case study communities, we asked them about 20 different indicators that could be impacting the future of the farm. And we were very surprised when we analyzed the results that we found that it was not the cost of land or farm inputs or planning and zoning regulations, but it was actually the cost of health insurance that was the most serious threat to their farm. And what's really especially significant about this finding is that it was really the commercial farmers that identified this big threat. And commercial farmers are those who derive the majority of their household income from the farm. And as one farmer said, 2 things are working as hard against the configuration of the business. One is rising land value, and the other is rising healthcare costs that have completely gone out of control. Healthcare costs are driving everything. It's also especially noteworthy that this data was collected in 2007, before the debates about the Affordable Care Act started. And this data point really dovetails with other research that has found farmers are more likely to be underinsured and hold policies with high premiums and high deductibles, that catastrophic insurance when they actually do have insurance. And families often need to access health insurance through off-farm jobs that can take time and energy away from developing the farm business and also decrease quality of life. More recently, in 2014, we surveyed 5 different case study communities and put some questions on the survey that more directly asked farmers and ranchers about health insurance. The Kaiser Family Foundation regularly polls the larger American population about their use of health insurance and attitudes towards the Affordable Care Act, the ACA. So I included some of the questions that Kaiser asks so that we can compare the farm population to the general population. In response to the question, do you feel you have enough information about health insurance and health care to understand how it will impact you personally? So our farmers are the ones in green. 46.1% of the farmers and ranchers who answered the question said yes. What's interesting, though, is that 53.9% of the farmers and ranchers said that they do not or they're unsure, which is much higher than the general population, which we see in green. So these previous studies led to the Hired in Ag project, the Health Insurance, Rural Economic Development and Agriculture Project, which was funded in 2014 through a USDA AFRI grant. Myself and Dr. Alana Knudsen with the Walsh Center for Rural Health Policy at NORC are leading a team from 8 different organizations and institutions representing both research and extension. And with the Hired in Ag project, our goal is really to understand how health insurance impacts both economic development and the quality of life of our nation's farmers and ranchers. And we really want to understand and then also teach how health insurance impacts workforce vitality and risk management in the agriculture sector. Our goal is to provide recommendations to policymakers regarding future policies and programs that will better support farmers and ranchers in their health care needs. So this is an outline of the different phases of our multi-year project. Starting this year, our project is going to be interviewing and surveying farmers in 10 case study states across the United States. However, our first task, which we completed over this last year, was to first conduct national listening sessions with extension professionals and technical assistance providers to understand how health insurance is being integrated into their programming and what kinds of tools are needed. So we learned a lot about some of the innovative methods that are being used, but overwhelmingly we found that there's really an acute need for more information. And this webinar is responding to the needs that Extension personnel identifies. So we are very pleased to be able to feature 3 Extension professionals today, Dr. Adam Kantrovich, Dr. Barbara O'Neill, and Dr. Roberta Riportella, who are actively integrating Health Insurance and Affordable Care Act into their programming for farmers and ranchers. And we hope that this webinar today will be useful for your work, and we also very much look forward to your feedback. This is our project website, www.hiredinag.net. We are posting reports and publications as they become available, and we will also have a link for today's webinar. Thank you.
Good morning. I'm Adam Kantrovich with Michigan State University Extension. I'm a regional farm management educator and have statewide responsibilities in a number of areas that include estate planning, farm succession, tax management, and some ag policy issues, and as well as the Affordable Care Act. And I was asked to speak with regards to kind of what we do here. And myself and Dr. David Schweikart, part of our Ag Econ department, about 3.5 years ago, almost 4 years ago, taking a look at what this was going to deal with and how it was going to affect our agricultural stakeholders, decided to pick up and try to run with moving forward with some programming of the Affordable Care Act. And this act affects absolutely everybody that's here in the U.S. legally. Every individual and business. There are some exemptions. In essence, the individuals need to make sure that they have appropriate health insurance to be able to cover themselves, their dependent children, and then employers really need to determine their status, whether they're considered applicable large employers or small employers, and what are their responsibilities based on their status. Now, according to the Small Business Administration, about 96% of all firms in the U.S., which account as well for our farms, are exempt in some fashion from having to deal with the Affordable Care Act from an employer standpoint, which is what David Schweikart and I picked up on. And shortly after we began this, Brenda Long, another extension educator here with Michigan State, which I believe is also here on the call, picked up and created a group through a grant and was working with the consumer side of the ACA, where David and I decided to pick up and work with the business end of things from an employer standpoint. Now, as we started working on this, we quickly became aware of a number of issues. And so we had to decide how we were going to go about dealing with this type of program, because this is a touchy subject. And so we wanted to make sure that we were able to develop fact sheets, publications. We developed a website. We actually have two websites. Brenda Long helped develop with extension personnel a larger program, ACA program website that really takes a look and is more focused on the consumer side of this. And through our farm management webpage or website, we developed a page for Affordable Care Act from an employer standpoint for our farms, ranchers, agribusinesses, and others. We also developed some worksheets. I developed a spreadsheet calculator that helps employers take a look at and decide and differentiate between whether or not they're an applicable large employer or a small employer, and begin to move them to the next step. We decided to also do significant programming to large groups where ACA was the main focus of the program, and these were predominantly 3 to 4 hour programs. And through those types of programs, as well as smaller 30-minute to 90-minute pieces of information within other programs such as ag labor, and then a portion would be Affordable Care Act, we've easily hit over 2,000 to 3,000 individuals. And what I found interesting was we had numerous farms that, when they knew we were going to speak, they would return time again and time again to see if there was any new information. We've also done a significant amount of speaking upon request to specialized groups. And so this would be, the Michigan Seedling Growers, Michigan Wine and Grape Growers Associations, etc. And so this has finally become a larger topic. Now, when dealing with these particular issues, there was a great deal of discussion due to the politics of dealing with the Affordable Care Act, especially within the rural portion of Michigan, and especially in West Michigan, where I live, is extremely conservative, and everyone predominantly was against the Affordable Care Act within some of our stakeholder groups. And David and I, knowing that this could become an issue, made sure that we went up the line with our administration, that if we were to start down this road, that they would back us up if complaints would start coming in because of us doing Affordable Care Act programming. And in fact, there were some stakeholder groups, including one individual that sat on the Board of Trustees for the university, that did begin to complain that because we were doing the programming, it showed that we were backing up or on side of the Affordable Care Act, which goes against their philosophical reasonings with regards to this, and that there could be political ramifications. Now, one of the things that David and I did, I took it upon myself to begin to work with some very specific farms, larger farms, and to use them as a beta test on our information, etc. David also has a law degree besides a PhD in economics, and so we really went through the bill with fine detail when developing our programming. but we still wanted to beta test some of our information on a farm, run through a process of making determinations on where they would fit, see how things would play out and work. And one of those farms happened to be a relatively large farm, and the individual was also a state rep to our capital here in Lansing. And he found this to be very, very helpful. And so any time we had issues with stakeholder groups or individual stakeholders, he rose to the occasion to meet with those particular individuals and helped explain the situation. Now, dealing with regards to this, we took it upon ourselves, knowing that when we were going to go out and do programming, that there would be individuals that would potentially vocalize their distaste for the bill. We wanted to make sure that we had some type of statement with regards to really what our role is with regards to this process. Now, regardless of political affiliation, etc., from our standpoint, we took a look at this as being no different than farm bill and subsidized agricultural programming, insurances, etc. This is a law. It's the law of the land, and it is our job to make sure that our stakeholders are aware of the law and what they need to do to be able to meet those regulations. They can choose not to if they wish, but at least we've provided the necessary information for them so that they can make their own decisions. And so this particular slide that we're showing you now is one that we typically show, we do show every time I stand up and give a presentation or a talk with regards to this. And make an attempt overall that if you want to talk about politics and everything else, I might talk with an individual afterwards, but the reality is we are there to provide information so that they can go ahead and move forward. So, some of the information that we typically cover. What is needed for businesses and employers? One is we have to describe what the employer mandate is. And the employer mandate simply states that if you have 50 or more FTEs for a monthly annual average, you are considered an applicable large employer. And based off of that, you are required to offer your full-time employees health care coverage that meets some very specific rules, minimum essential benefits, and coverage affordability. There are some safe harbor rules that you can utilize to see and make sure or do as a double check that you are meeting the affordability portion of this, or pay a penalty. And so we cover that type of information as how to determine this, because part of determining whether or not you are an applicable large employer or small employer, you also have to determine employee classification. And then once those workers have been classified and you make a determination that you are large or small, and then if you are a large employer, you may have to again classify your employees to make a determination, who do I have to make an offer to? Now, all of this being said, just because you might be considered a small employer below 50 FTEs for an annual monthly average doesn't mean you're out of the woods and that you do not have to do anything. We have many farms that utilize different methods of providing benefits to their employees. And some of these methods that have historically been used can open them up to other types of penalties, such as the excise tax and potentially non-discrimination issues. Now, the excise tax states that if you are offering some type of health care benefit, it has to meet, regardless if you're large or small, it still has to meet the same type of guidelines and rules. And in many cases, what we have seen in the past is some of those smaller farms, let's say a dairy that may have 7 or 8 employees, and they decide that they have some long-time employees they would like to keep, and so they have said, bring in your health premium cost receipts and we will reimburse you. And they do this for 3 or 4 individuals. Well, this creates some problems which opens them potentially up to an excise tax. Or they may say, if an employee's wife gets sick and she goes to the doctor, or their child breaks an arm and they go to the doctor, that they would reimburse these particular benefits in some fashion. These open up these employers to the excise tax, which is up to $100 per day per employee, so it's relatively significant. Now, the non-discrimination issues for all employers, whether they're large or small, we aren't sure. There's always been a non-discrimination clause on dealing with fringe benefits as it relates to such things as health care. It's been around for decades, and this deals with the highly compensated. Well, there's also a non-discrimination piece within the ACA. However, guidance has not yet come out, and so we do not know some of the specifics on what is going to take place with regards to this. However, when I had a conversation with the Chief Counsel's office back in the spring of 2014, I kept pushing him with regards to this particular issue, or the individual from that office that I was talking with, and they were reluctant to give me any information except that they would provide guidance in the fall of 2014. We've gone over a year past that now. I kept pushing him with regards to, is this going to be only for large employers or small employers? And at the time, the response was, why would this not cover everyone? And so this can bring up some of those issues. Again, if you're a small farm, you have maybe half a dozen, 8 or so, maybe a few less or even more employees. I do not provide health insurance to them, but I provide health insurance to the employees that may be a spouse of the owner or the children of the owner and nobody else. This could potentially also get hit with non-discrimination, but we do not know for sure. The other piece of this are dealing with tax forms. There are tax forms, 1094 and 1095, and then there's a different series, A, B, and C. The A is provided for by the exchange or marketplace for those that receive health insurance. And so for most employers, we don't have to deal with this. However, if you are an employer, if you're a large employer providing health insurance, you're going to have to deal with forms 1094C and 1095C. Health insurers, such as Blue Cross Blue Shield, Cigna, etc., are predominantly going to have to deal with 1094 and 1095B. But you might be considered a small employer and you provide health insurance. And if you are self-insured, then you may have to also deal with 1094 and 1095B. Large employers that provide health insurance are going to fill out the C series, regardless if they're self-insured or they go through an insurer such as Blue Cross Blue Shield. Now, there are a number of major issues and challenges with this, which many stakeholders that I work with, they are constantly calling me, requesting updates. I keep in constant contact with a number of lobbyists in D.C. and a number of staffers and chief of staff for Senate and House individuals in D.C. to get the most up-to-date information, where they see things moving, etc. There are constant legal challenges. I stopped counting at the legal challenges after about 45 or 46. This includes challenges at state level, district court level, and the Supreme Court. Very little has changed from those, with the exception of birth control issues by certain religious employers, such as churches. There was, I think it was Hobby Lobby, that due to their religious affiliation and philosophy, that they didn't feel like they should be able to provide or have to provide birth control measures as part of their health insurance plans. Another issue is there are different legal definitions under the Affordable Care Act versus the Department of Labor and other agencies. And this is very, very important because this can become very confusing for some large employers. So one example of this is seasonal worker and seasonal employee. Those definitions are different, more restrictive under the Affordable Care Act. Guidance and formal legal agency interpretation has not been released on some parts of the Affordable Care Act, such as dealing with the non-discrimination clause. Some groups and individuals and industries, such as the insurance industry, unfortunately is spreading false and incorrect information when working with farms and agricultural employers. And this is not, I see this a lot in the state of Michigan, but I am well aware of this in other areas in the upper Midwest, down south, and out west as well. And so this is becoming very confusing with employers when they are trying to meet with insurance professionals who are telling them, here's how you have to do a count to figure out if you're large or not, and who you have to apply this to. They are flat out wrong in many cases, not all the time. And so this is something we have to be aware of. Meeting legal obligation versus human resource labor management for employers. This is another issue. And attempting to meet our legal obligation becomes very difficult because we have many employers who are looking at this, what do I have to do as a minimum, instead of taking a look at a larger picture from a labor management issue. And what do we have to do internally to our business to make sure and keep up and track what we need to meet our legal obligation. They may have to change or update software, get new software. What changes do we have to make administratively? What do we have to communicate legally to our employees? And what are the labor expectations with regards to this? And so this here, you'll be able to, I believe they're going to make the presentations available afterwards. I have created links to our website. If you go to our particular ACA website, you can also get a link to the page that was developed by Brenda Long that has consumer side of things in here. And so hopefully you can take advantage of it. One thing that is very important is that employers are required within 14 days of hire of a new employee. They are required to meet, if they meet FLSA guidelines, Fair Labor Standards Act, meaning they have more than one employee and a few other pieces, they are required to provide notification on whether or not they're going to provide health insurance or not provide health insurance to those particular employees and what the guidelines are and requirements for that individual to have health insurance. And you can find templates in English and Spanish that have been developed by the DOL at our website or going straight to the DOL. Here is my contact information if you have any questions or comments. For those that are involved with ag employers, I'll also be talking as part of a panel in Vegas at a national conference, the National Conference of Ag Employers, here in a few weeks. For those of you that might be in areas that have high H2A individuals within their states, this is becoming a major issue, as well as it relates to taxes as well for those individuals, because there are some specific guidelines that people just don't understand. They're relatively simple, but they're making it more confusing than what it should be. Thank you.
Our next speaker, I believe, is Roberta Riportella. And she's going to talk about some of her programming to show what some of the other ways that you can approach this. And Roberta is from Kansas State University and also has spent some time at Wisconsin-Madison. Go ahead, Roberta.
Thanks very much, Scott. I'm assuming folks will chat with me if they can't hear me. So I'm now at Kansas State University, which is K-State Research and Extension. And folks may have known that for a long time I've been looking at the Affordable Care Act And it was Barbara O'Neill, I believe, who came to me a few years ago and said, you know, Roberta, there's a special population of farmers that needs to think about the Affordable Care Act. So she and I started working on a curriculum. We weren't as planful as Soshanah has been about thinking about what farmers needed to know. We just kind of dug our heels in and started working. Basically, I was asked to look at what the consumer side of this is, and what I'm going to do is give you some quick content on how the Affordable Care Act impacts farmers and ranchers, and then later I'm going to talk to you about some resources that are available if you're going to be doing this kind of education. Basically, farmers and ranchers, when they're not dealing with their business side of this, are just like all other consumers. They have the same mandate to be insured, same consequences for not being insured, same protections to purchase insurance, same menu of insurance options, same opportunity for financial assistance. Just remember that the Affordable Care Act has lots of different things that are going on, and part of it had to do with the insurance market, but some of it had to do with how the healthcare delivery system was going to change. And we're feeling that as consumers in terms of who the providers are, the fact that we now have preventive care that's for free, and we're seeing some lowering of healthcare costs. The kinds of protections I was talking about really have to do with requiring insurance companies to take all or seeking insurance and to keep them insured. So you can't get a cancellation of a policy because someone's too sick. No more lifetime or annual maximums. And this exclusion is really important for farm families because there are no more exclusions for any consumers who had a pre-existing condition or are in a high-risk occupation. By the way, Adam, when I spoke to farm families, when they started to see this and how their premiums were not going to be differentially affected because they were farmers in a high-risk occupation, they started to calm down about what the Affordable Care Act was and what the opportunities and challenges were for them as farm owners. There is no rating based on that occupation or on other risk factors as well. So the consumers are mandated to purchase insurance. We have this new marketplace that's out there, and we're really pretty established with this now. We're entering year 3. It builds on the current employer-employee fringe benefit system. So if there's somebody in the farm who's working somewhere else for an employer, they're under those kinds of opportunities, restrictions, whatever, of getting insurance elsewhere. And it was also intended for states to expand their Medicaid programs to include all individuals and families under 138% of the federal poverty line. If we think about this, it's sort of a three-legged stool. We have the employer coverage, the marketplace exchange coverage, and then the public programs. The Medicaid expansion matters differently to farm and ranch families. There aren't any asset tests associated with this particular Medicaid program as opposed to other Medicaid programs. And the eligibility for financial assistance is based on the MAGI, the modified adjusted gross income. So if one's MAGI is less than 100% of the federal poverty line, you're not going to be eligible to purchase in the marketplace because all of the financial incentives go to people above 100%. So all of the subsidies, and Barb will explain those. So Medicaid would be an option. But not all states have chosen to expand their Medicaid program. So this is what it looks like. There are 31 states that are expanding Medicaid. There are 19, the brown ones, that have not chosen to expand. They can at any time, which is why we're still watching Utah. And again, this matters because there are some farm families who would qualify because most of their wealth is based on their asset of the farm, and their income is low enough to have qualified them. So in those cases, it's going to matter which state they live in, and they may decide that maybe they want to be part of the discussions about whether or not their state expands Medicaid. The marketplace is another part of the stool. Those are managed at the state or federal level. Doesn't seem to be making too much of a difference. You go in through healthcare.gov and you're directed to either your state's exchange or you stay there. You can apply now. People are in the midst of this right now. We're in open enrollment. It's guaranteed November 1st through January 31st, and it has varied every year so far, but I have a feeling these dates for this year are the ones that are going to see us into the future. There are also qualifying events that happen outside of open enrollment, so I think that this educational program with farmers and other consumers is really a year-round effort because people have their status change. So you have a new member of your family, you lose a member. You get married, you get divorced, you have a baby. You may lose job-based coverage, you may move out of the coverage area, or you can gain citizenship. So those kinds of things make you eligible for enrolling in the marketplace plan outside of that usual enrollment window. And the enrollment has to happen if you're in an employer-based plan, usually 30 days within that event. For the marketplace, you have 60 days after the event to make a change and to enroll in the marketplace. And a lot of people don't know that. This is what the marketplace looks like for us right now. If you go into healthcare.gov, and it's very much fully operational. We still have the different levels of health plans that are out there, the bronze, silver, gold, and platinum. And the more you pay in premiums, the less you're going to be paying out of pocket. I just might comment that I've been looking at the different premiums and out-of-pocket payments that are there. Some of these plans are extremely expensive plans that you may find a 50-year-old paying $500 a month for a premium and still have an deductible, that's the word, a deductible of $2,000, $3,000, $4,000, so that you're asking a family to spend $9,000 on their health care before their insurance will kick in. I think that's an issue that we need to discuss with families so that they really understand the financial implications of having insurance. Certainly not a reason not to have insurance, but it's just something people really need to consider. There are limits on those out-of-pocket costs, and people, kind of cringe at the level of this. But it used to be that insurance policies didn't have. You could be paying forever. This way, at least you know that you should be putting aside $7,000 for an individual and almost $14,000 for a family for your rainy day fund. If, God forbid, there's a hospitalization or some other major health care expense. So what families need to do each year, they need to consider if they like the plans they're on, and this is whether or not they're an employer-based plan, in the private insurance market, or in the marketplace itself. If you purchase through the marketplace, there are redetermination procedures. Everybody should have gotten their letters already. You have to pay close attention because the plan you had last year may or may not be good for this year. So you need to see what that says. And if there's ever a change in income, you're supposed to let the marketplace know on an ongoing basis, I believe every month, to let them know so that the amount of subsidy you get will change. And again, Barb will talk about that. If you didn't purchase health insurance, you need to think about how it affected your penalty in 2014. You've already seen that. And consider how it's going to do that going forward. So if you want to avoid a penalty, now is the time for you to get your health insurance. If you're purchasing in the marketplace, you have until January 31st. But most of the plans that are out there are following what the marketplace is doing, because the private insurers don't want to get all of the people who wait until they're sick to look for insurance. Because remember, they have to take all comers. So it matters that you really look at this January 31st deadline. And just as a reminder, there's lots of choices to be made, whether or not it's a bronze, silver, gold, about the network of providers, the essential benefits, deductibles, copays, and drug formularies. And I'll show you in a bit what resources available to help you do that. These are the phone numbers for consumer assistance. There are navigators or certified application counselors in every state to help people make their choices. There are also agents and brokers that are licensed by states, and there's additional training that is required for those brokers to actually do the ACA work. And these are some links to some helpful tools on the web. You can find premium estimates now if you don't want to make a choice before January 31st, or there's a subsidy calculator if you think you might be getting some assistance. So that's all I have to say for now. Thank you.
Well, thanks, Roberta. And I think next up is Barbara O'Neill to round out the session. Barbara, you got the PowerPoint? Okay, there we go.
Okay, I'm assuming that everyone can hear me. If not, let me know. I believe I've unmuted myself. Okay, so I'm going to be coming at this from the standpoint of a certified financial planner who's kind of looking at the income taxes and how they interface with the Affordable Care Act. So Adam used this term before, at least he shared the acronym. The Individual Shared Responsibility Payment, or ISRP, is the term that the Internal Revenue Service is using. So while many of us would be referring to this as the fee, the penalty, even the tax, the official term is the ISRP. And the IRS uses this term because they want to denote the fact that, as you've already heard, individuals have a responsibility to participate in the health insurance market, as do employers. So the ISRP was relatively low for the first year of implementation, which was the 2014 tax year. So, of course, that all took place earlier this year in the first quarter of 2015. But there's going to be significant increases in the subsequent years. And you've already heard that there are basically two different mandates that are in effect. Roberta talked about the individual mandate, and of course Adam talked about the employer mandate for the large employers who are subject to the rules based on their number of full-time equivalents. So I think I went too fast there. This is a graphic from Kaiser, and I know the number is a little bit hard to read, but I want to kind of walk you through what the fees are for the tax year 2015. So these will be the taxes that people will be filing their returns for in the first quarter of 2016. So this year, the fee is the greater of, and you got to keep this in mind because for most people who are middle income and above, it's not going to be the flat fee, it's going to be the percentage of income that's going to be the greater number. So in 2015, it's the greater of $325 for an adult and $162.50 for a child, half that amount, up to $975 for a family if you use the flat fee method. But for a lot of people, it's going to be the 2% of annual family income. And that can go up to a threshold of $12,850 if you have a couple of children. Because basically what they're doing this year is they're doing 2% of your annual household income above the tax filing threshold, which is, I looked it up, it's $10,150 for an individual and double that, $20,300 for a married couple filing jointly that are under age 65. So for some people, it could be a five-figure amount that you're being faced with. It's not chump change, and it's actually going to be scaled up even further in 2016. So as far as the Affordable Care Act goes on the personal finance side, there's two different provisions that can help families, individuals and families, lower their costs for their health insurance. And the one that really interfaces with the tax system that we're going to talk about is the premium tax credits. And these help people pay the cost of their marketplace plan. And it's based on their family size and their household income, and they have to be below 400% of federal poverty level. And then for those who are up to 250% of federal poverty level, and they have to be enrolled in a silver plan, those people will also receive what they call cost-sharing reductions. And these help people to reduce their out-of-pocket costs for their deductibles, their co-pays, and their co-insurance. So both of these are income-based. And so, let's see. Going a little bit too fast here. So 2014 was the first year ever that the health insurance system interfaced with income taxes. So the two key audiences that many of us were trying to reach in cooperative extension programs were people who were uninsured for all or part of the year 2014, and then also people who had received their premium tax credits and were trying to interface that with their federal tax return. And many people were unaware that they had to pay the fee if they were uninsured, and also the reconciliation process was daunting for people who had those advanced premium tax credits. For most people, though, more than 75% of taxpayers this past year, all they had to do was click a box on line 61 if they used the 1040 form and basically say that they had full year health insurance coverage. So taxpayers with a marketplace health plan, as you probably heard, Adam referred to this, you will receive a 1095A form in the mail if you were getting insurance through the marketplace, even if it was only coverage for part of the year. And it includes all the household members who were in the qualified plan. People can also go to healthcare.gov and download the form if they prefer. And the 1095A form is more of an informational form. It provides people with the information that they need to fill out an IRS form, which is called 8962. And that form is the one that is attached with somebody's federal tax return. And like all tax forms, the 1095A, that's 8962, any of these forms should be saved with a person's tax records. So the 1095A, what it does is it gives people information that they need to complete their Form 8962. And specifically what it does is it provides information about the amount of the premium tax credit that was paid to a healthcare provider on a consumer's behalf. Because most people choose to have the law be implemented in that way so they don't have an high initial cost, and that their tax subsidies are taking place every month to help pay their premium bills. So people can even get more than one 1095A. Maybe they switch plans during the year. Maybe they reported some of those life changes that Roberta talked about. Or maybe they had more than one marketplace policy covering people in the household. So what you want to do with the 1095A, of course, is to check it. Make sure that the information is correct. It matches your own personal records. And then, of course, you'll be using that information about the benchmark premium that needs to be included in your tax calculations. And keep in mind that people who are on Medicare, people who are on Medicaid or CHIP program for children, they do not get a 1095A because they're in their own specific plans and not enrolled in a marketplace plan. So, I'm trying to, this is getting a little, there we go. Got to be really careful on switching those slides. Okay, so what happens is that when you look at the premium tax credits, there's actually two different categories, if you will. There's the advanced premium tax credit, which is what most people receive, and this is determined by the marketplace. It's based on estimated household income because you're projecting forward what you think your income will be for the following year. So right now, people who are in that open enrollment period that Roberta is talking about are going to be doing their best projection about what their future income will be. And this money is paid to the insurance company on behalf of the consumer on a monthly basis to help pay their premiums. And then we've got the premium tax credit, which is where it all comes due at tax time. That's determined by tax law. It goes along with your submission of your return. It's based on your actual household income and family size, and you settle up at the end of the tax year. So this is kind of what people had to go through for the first time this year, that they had to do this reconciliation process because they had kind of actually had to project their income, in some cases, a year and a half before they actually earned it. And so earlier this year, people had to do this reconciliation process. So if their advanced premium tax credit was less than the premium tax credit amount, they got an increase in their refund or they had a lower tax bill. On the other hand, if it went the other way and people had more advanced premium tax credit taken out than their actual premium tax credit that they were entitled to, then of course their refund was smaller, or they had a balance due. And there were a number of stories about people who were kind of caught up with that. So just keep in mind that people without health insurance, there are exemptions, and that's listed in the last bullet point. They're not things that I would necessarily want to do, though, to be exempt from the law. In other words, you'd have to have some kind of hardship or be in jail or have a low income, not things that people necessarily aspire to. And the fee that you'll be paying is based on the number of months without coverage, and of course looking at the income that I mentioned before as well. So what they're really trying to get at is people who could afford to buy health insurance but are choosing not to for whatever reason. So the fees are interfaced with the tax return, and the refunds that people get are basically either for having taken out too much of the advanced premium tax credit or not having insurance anyway, just not having insurance. So if you don't have a refund, what happens with the Affordable Care Act is that the IRS is able to separate, apparently, the amount that you owe and the amount that's due to the Affordable Care Act versus the amount that might be due to your ordinary income tax situation. They can separate them, and they're not treated the same, because if you owe taxes based on your ordinary income, the IRS can do things. They can take liens on your house, on your property, your bank accounts, levy the bank accounts. They can't do that for the health care fee. So what they can do is they can get your tax refund, your future tax refunds. And not just the current year, but also future years. If that's an accruing amount that is owed, they can get it from future monies. So just to kind of wind up on my section here, so the Affordable Care Act fee is you pay it for the months that you don't have coverage or you don't qualify for an exemption. And as I mentioned, the tax penalties can be pretty high. That slide shows the 2014 figures and slightly higher in 2015. You are allowed a single period of less than 3 months without an Affordable Care Act plan in a single year. And there are a number of calculators online. There's a link for one of them there that can help people make those calculations. So what happens with the tax return is that the amount that's due, it goes on that same line 61 that I mentioned before, where people report that they had coverage or not, and it's payable there. The 8962 form that gets attached to the tax return is very complex. It has a matrix where there are 12 rows and 6 columns. And the reason you have so many rows, of course, is because everything is calculated on a monthly basis, and you're looking at the subsidies per month. So it's a pretty daunting form to have to fill out, particularly for people who in the past may have been used to very simple tax returns and not had to have such a complicated statement. So last year, the workers didn't get a statement from their employers. There just wasn't enough time to gear up for that. So it was pretty much on your honor system saying that you had adequate coverage. In the future, your employer will be sending you and the IRS a statement that will document the fact that you have adequate coverage. So there's 2 forms that are out there related to the Affordable Care Act. I already mentioned the 8962. This is the form that's used for people who are trying to do the reconciliation process between their advanced premium tax credits and their actual income. And then 8965 is another form for people who qualified for exemptions for the Affordable Care Act. And I'll just end up with 2 more slides. This is a slide that talks about a good income tax resource. This is from the IRS. It's a new publication that they came out with, which is 5187, that goes into deep detail about how you need to use tax forms to settle up with your Affordable Care Act individual responsibility. And then the last slide that I have is just some other resources in the community. VITA volunteers, many of them have been trained to deal with the additional forms required by the Affordable Care Act. ARP has the tax aid program. And then there may be some other programs in local communities. In some states, for example, Cooperative Extension is very active in preparing taxes. And I think of the states of Georgia and Missouri in particular. And there may be United Ways and senior centers and other places that will also prepare taxes. So I believe I handed over to Roberta to talk about some resources for educators.
Yeah, I think we're going to offer this as kind of a bonus session for folks if people are able to stick around. I will put up the evaluation as well, so folks can fill that out. It's clearly a huge undertaking, understanding all the different nuances that are out there for the Affordable Care Act, and we've just kind of scratched the surface of it today. So if folks are able to stick around and listen, our resource people are here, and they do have some more things to say. So I'll leave it up to you to make that decision. I think there's some good resources that we haven't touched on. So I'll
Okay, Scott, this is Ruth then. So I will do that. I believe that you're also going to make the slides available, so for those people who can't stay on, they could at least have the information.
Yes, we always put the slides next to the archive of the recording of the webinar, so it's all there on our website.
Okay. All right, let me see how quickly I can go through this. I just wanted to make sure people understood that there are a number of curricular resources. If you wanted to be teaching about this, the ACA for Farm and Ranch Families, Consumers and Businesses, or Health Insurance 101, which is you saw from some of what both Barb and I were talking about, is really part of understanding this for farm families. This is the curricula that Barb and I worked on. We got some assistance from Heidi Johnson in Wisconsin's Extension, Nadine Seagal from here at K-State, and my grad assistant who continues to help, Katie Breeze. That curriculum is now being housed on a Basecamp project site. Now, if you've never used Basecamp, it's an online program. It's really very easy. What it allows you to do is have project updates and discussions and housing files. And you can see right there, those are the files, or some of them, that are being housed. The way that you become part of this Basecamp is send me an email. You will get a link to a registration page that I will send back to you. Complete that registration, and then Basecamp will let you know that you've been invited to the project. You accept that invitation, and you proceed to use the materials. Anyone who has participated or viewed one of the several Smart Choice for Farm Family webinars is eligible. What you heard today is a little less than what I feel comfortable with, so I would appreciate if you would go and take a look at one of our previous webinars on farm families. To access it, we recommend that people go to the Basecamp site regularly and look for the latest information. So you can contact me if anything to do with that. This is a webinar on Open Enrollment 3 that I just did 2 weeks ago, and these are the topics it covered. If you want to get it, Google my name. This is what it looks like. What do you need to know as open enrollment for the marketplaces is around the corner again. You're probably not going to be quick enough to get that particular URL on the top, but so that one is was recorded, and that really goes into detail about where we are with open enrollment and how it would change the work you're doing now with families, farm families as well. Also, there's a bunch of resources that we've put together at K-State. There are a bunch of fact sheets that are up there about the Affordable Care Act. There's also this Health Insurance Smarts program, which helps consumers understand how health insurance works. And we have that on its own Basecamp. This is the team that put that one together. And so if you're interested in accessing those materials, let me know that's what you want. It'll be the same process. of getting access to the base camp. And of course, there's this Smart Choice Health Insurance, which is now developing a program on health insurance basics, and that was developed out of Maryland and Delaware. And the Smart Use Health Insurance, we're told, is coming early in 2016. So these are other resources that are out there that can help you become comfortable with what the Affordable Care Act is, how it works, thinking about it in terms of farm families as a particular target population, and then how those farm families need to think about how health insurance works. Okay. And that's for Barb to just give us some idea how we might evaluate those programs.
Okay, very quickly, I just have 2 more slides. If you're doing programs for professionals, train-the-trainer types of programs, let's say, some of the ways that you might want to evaluate that would be, did they use the curriculum materials, either in classes or in media? How many people did they reach? Did they increase their knowledge about the Affordable Care Act and health insurance? And then probably even more importantly, did they increase their confidence about their ability to teach the Affordable Care Act information? And then also, did your training motivate people to seek out additional information from other resources? And then also, if you want to do programs in the community for actual farm families, some of the ways that you can evaluate those programs would be the increased knowledge about the Affordable Care Act and health insurance, increased confidence about purchasing insurance, again, motivating people to seek out additional information. And then if you're able to get some estimates or actual amounts of the decreased cost of health insurance, because as you've heard, farm families paid quite a bit for health insurance before the Affordable Care Act went into effect. And now with more choice of insurance companies and also perhaps some of the tax benefits as well, their costs could have been decreased substantially. And if you're able to aggregate that across a number of people in a class, you could end up with a pretty high number. And you may think of others. Quite honestly, we haven't really developed an evaluation form. We were kind of using a pretty extensive methodology through University of Maryland when the curriculum was first developed, and that's probably something that Roberta and I need to get on our radar screen, is maybe a simple after-class evaluation form and maybe a 3-month follow-up, something like that, that we can get at some of these metrics that I mentioned. So that's it for me, and I think I'll turn it back over to Scott.
Actually, Scott had to leave for a meeting, so if you want to go ahead and put your questions in the chat, and as the presenters, you can go ahead and answer them as you have been throughout the presentation. Okay.
Somebody should quickly type in if their question hasn't been answered. Or to the best of our ability right now, I know who I have to follow up with. And can you send us these, what's in the chat room as an attachment?
Yeah, I'll send that off as an email. So if there's any participants who would like to put their email in the chat box, and maybe I can send it to the presenters, and then they can sort of go from there. Okay, there's a question from Dave Young. Could someone speak to the period of pre-enrollment and how presumptive eligibility plays into coverage before January 2016?
Yeah, Dave, I actually just told you in an earlier chat there that I'll try to get back to you on that because I don't know. I assume you're asking because of the incarcerated population that may be coming out. Usually presumptive eligibility is really just for the Medicaid population, so I haven't thought about how it affects, but I can try to figure that out.
Yeah, Dave, if you can put your email in the chat, she can contact you via email. Thank you.
Yeah, okay, Dave.
Okay, and Soshanah added a note about any special topics. Feel free to put them in the chat, and also, if you can, put your email in there so that they can contact you regarding this. Okay, it looks like things are wrapping down, so I'm going to go ahead and thank you for your presentation today, and I will send you the chat, and you guys can communicate with the participants via email, and if there's any questions, please feel free to let me know.
Thank you, Rosa.
You're welcome. Thanks for all your patience in this, you guys.
Bye. Bye-bye.